Well, Pritish, thank you very much for coming on this program, because I know you've been working night and day for the last few months. Some of your colleagues have told me that, so it's very kind of you to come on. Well, would you like to introduce yourself to us, please?
Okay, so I'm Dr. Pritish Maheshwari. So I'm based in Mumbai, India. I'm a pulmonologist and critical care super specialist over here with the experience of around 10 years into this field. I'm currently practicing as an attendant consultant in Bethany Hospital and few of the other hospitals here nearby.
So have you been involved in the COVID pandemic all the way through since 2020?
Yes, actually, once when it was started from the beginning only, we've been involved in the COVID management.
And how was the first wave, the original Wuhan strain?
So first wave, actually, we were quite unprepared how the things are going to be. And it was quite a difficult decision at that point of time to take, how to go about it. So basically on the personal front, it was the first thing came actually on the personal front, where to work or not was a very difficult decision to take. There was quite a bit of internal conflict where whether to opt in or opt out. A lot of colleagues, senior colleagues, were actually opting out. There were few people who were opting in. So it was a big challenge to decide how to do about it. We were quite
we know that many hundreds of people are alive now because you did opt in, as your colleagues have told me. So it's
even most of the colleagues eventually did opt in. So there was initially the concern of fear and safety, where we were not sure how we are going to handle. There was a big misjudgment in the level of faith, whether we were equipped enough to handle the things. Lot of what ifs were there. Also, most of the colleagues and ourselves, we were quite worried about the familial concern also. And it was difficult to make the family understand that this is actually a need and we have to go ahead with that. So technically, it was never a choice, actually.
Indeed, yeah. So in the first wave, the original Wuhan wave, what sort of patients were you seeing then? Were patients being admitted with pneumonia and cytokine storm and acute respiratory distress syndrome?
Yes, so when we started with the first wave, most of the patients who were coming to us were coming with the acute emergency. They were presenting with very short clinical history of breathing discomfort and fever, high grade, and they were just coming with such low levels of oxygenation that we were quite frightened to see them.
What sort of saturations were you seeing in patients being admitted? What sort of levels?
So actually the patients were coming with the numbers of 70 to 80s in the saturation, and that was quite frightening the way they were presenting and pouring in the numbers.
Indeed. And was it similar in Delta that you were seeing severe complications, or was Delta even worse than the original Wuhan wave, do you think?
Yes. So once the Delta started last year, earlier in the month of April, so in Delta also patients were presenting with acute complications. They were just coming with acute cytokine storm, where it was just that we were not able to maintain them despite going very aggressively with the management. So we were
so basically they were coming in this cytokine storm. It was causing like a septic shock, and their lungs were filling up with fluid with the acute respiratory distress syndrome. You were getting those two things together.
True. That is how they were presenting, and they were all into a severe ARDS state where the oxygenation was just not maintained despite putting them early on the mechanical respiratory support.
Yeah. And of course, these were the patients that were lucky enough to come into your care. There was many people that weren't able to access care, especially in the rural areas.
True, there was a challenge in that regard also, because the numbers incoming was so high that we actually had to, it was a very difficult choice to whom to admit, whom not to admit. And there were patients who actually required care, but because of such a heavy pouring of patients flow, there were patients who were not able to receive that care what we wanted to give.
Must have been, apart from the personal tragedies, it must, as a physician, it must have been very difficult for you to watch that.
Yes, true. It was an emotional turmoil where it was very difficult to take that decision. It was actually affecting our conscience, whether we are taking the right call or not.
Yes, but there was no one better positioned than you to make that decision. So much better that you made it than anyone else would make that decision. You were more likely to get that decision right than people who weren't as experienced and skilled as you are, I think. So, but I know it's a very difficult thing to live with as well. Yeah. Now, what about the time of Omicron? What's the difference now that you're seeing from the Delta wave?
To be honest, with Omicron, things were much better. Most of the patients who were presenting were with a very mild form of the disease. And good thing, most of them have just upper respiratory involvement. They did have high-grade fever, but good thing they were lasting for just 2 to 3 days, and most of them were recovering within 3 to 5 days span.
So much shorter duration of illness with Omicron compared to Delta.
Yeah, so Omicron was much easier to handle. Irrespective of the comorbidities and age, most patients improved very rapidly.
Now, do you think that the reduced problems with Omicron were due to developing immunity within the population in India, or do you think that Omicron is intrinsically less pathogenic, or both?
So basically, it's a tough question to answer at the juncture. We are not very well aware how the things are going to be further. But so far, since it is not causing such a severe disease, it looks like the virulence of the disease, the virus, is definitely reduced. And we are probably heading towards the end of the pandemic, the way things have been going on these days. And that's what we hope for.
How have you been personally, Pritish? Have you contracted COVID yourself?
So by God's grace, I have not yet. So for the past 2 years, somehow with all the maintenance of hygiene and maintenance of the protection wear, things were handled quite well. So most of our colleagues were throughout well during the COVID scenario till so far.
But I know talking to friends in India that basically almost everyone seems to have had Omicron infection in India.
Yes, so in my family, a couple of people have had it. But I think because of the vaccination, it is one of the biggest beneficial factor which has prevented us to contain any infection.
Yes. Now, do you think now that people have been vaccinated and then had Omicron infection after that, is that going to improve the quality of immunity, this hybrid immunity that people have been talking about?
So there is a possibility, looking at it with a mild variant of infection, obviously when the infection sets in, it does provide the immunity. So we are hopeful that this Omicron variant is going to provide a good herd immunity with most of the people who've got it. So as we say at this juncture, the disease of COVID now is most of the disease of unvaccinated, non-vaccinated individuals at this juncture.
Yes.
And most of the patients who present also have such a less severity, I guess probably because of the vaccination, which is giving that protective benefit.
So we've got the vaccination benefit that's protecting us, and then the Omicron is coming as well. So we're getting this extra immunity. And it sounds like you're hopeful that both of those two things together will lead to herd immunity in India. Is that your belief, hope? What do you think?
Yes, that is what I hope.
Yeah, we certainly hope it. Do you think it's true?
Yes.
Do you think that's likely to? Do you think India's near herd immunity now?
So if we look at the population here, most of the people have been affected at one point or the other time.
Yeah.
Though we have very less number of testings being done these days because of the availability of the home kits also, and difficult to maintain the data.
Yeah,
it's
sure.
Huge population, and now since the disease is so less severe that even people also don't want to get evaluated further. They don't want to get treated, as most of them are getting symptomatically well within just a short span.
But I think we can assume that many hundreds of millions of people in India have been infected with Omicron over the past 6 weeks. Is that a reasonable?
Yes. I think it's much more.
Yeah,
the number we have, it's much more.
Maybe 1 billion people have been infected. It's because it just spreads so rapidly, doesn't it?
That's right.
Yeah. So with Omicron, you're seeing mostly upper respiratory tract infections. The people that are getting sick, what sort of comorbidities do they have?
So not technically the comorbidity is affecting the Omicron infection. It's actually highly infective if we compare it to Delta and the previous strains. Almost 3 times infectivity is higher in this particular variant. But then it's not really affecting the comorbidity as such. Patients with a old age, highly comorbid conditions also responding very well to the treatment. And just with the symptomatic treatment, they are getting better in no time.
This is remarkably encouraging. So people that were dying from Delta are now recovering really quite well in the age of Omicron.
True.
Yeah, I really feel that Omicron is a blessing to humanity. It's if we hadn't had this and Delta had just carried on, did you think the death rates would have remained higher for longer?
So with Delta, I still feel the death rate is on the higher side because we've been getting few of the patients who have a sort of mixed presentation of Delta as well as Omicron. And those are the ones who are actually deteriorating while treatment ongoing.
Right. So it's like so there was like some Delta cases still coming through, even though the new cases were Omicron.
Yes, there are few cases, but most of the patients who are presenting with that are the ones who are not vaccinated. So that's what we are saying. It is a disease of non-vaccinated individuals now.
And that is what you are seeing. Yeah, that's interesting. So so when someone comes in, it's mostly upper respiratory tract infections. But I mean, it's still true that the people that are getting sickest are the ones with comorbidities, with obesity or diabetes or.
So they have usually a severe presentation initially, but once they start responding, then they turn around rather well.
That's so encouraging. Even people with comorbidities are still getting better.
Yes. Only concern is these patients are the one who sometimes go into secondary complications, like secondary bacterial infection. And that's where we get a little difficult situation to handle.
So are you seeing a lot of bacterial secondary infection after Omicron?
So not much as such, because we've been very judicious while using the anti-inflammatory steroidal medications. And we are just going ahead with a plan of treating symptomatically. So far, we've been blessed that we are not getting so much of secondary bacterial infection load or fungal infection load at this juncture.
That's excellent, because I assume it's fairly common when someone has a viral respiratory infection that you get secondary bacterial infection. That's
true.
That's something you spend time, but if they do, the antibiotics are available and that's treatable, so it's not as concerning.
Right.
Yeah. So what sort of treatments are you carrying out on people? Obviously, we're not advising treatments on this video, but what sort of treatments have you been carrying out on your patients when they're admitted?
So primarily, we are targeting the symptoms, and we go mostly in the symptomatic management.
Yeah.
Now, people who have high comorbidities, involvement of lungs, or high-grade presentation of fever, that is where we are targeting and starting with the antivirals a little early in the phase. Though it is not clearly recommended that it is going to be really helpful or not, but still, as a part of the availability of the drugs we have, we are going ahead with the antiviral management from the beginning in such patients.
Right, so antivirals at an early stage.
So not in the early stage, in the moderate to severe cases.
Okay. Yeah. And what antiviral medication are you actually using?
So we have just 2 antivirals available. 2 oral antivirals like molnupiravir and favipiravir is available. And 1 intravenous injectable remdesivir is available.
Okay. So and are you finding those helpful?
So far, I would say the injectable we have find a good results. To say whether it is clinically significant or not is difficult at this point.
Right.
Because a lot of studies are against it.
Yes, indeed. And are you using supportive treatment? So do you use vitamin D? Do you use zinc?
Yes. So at this point, like we are using anti-inflammatory low-dose corticosteroids as per the inflammatory markers. we are going ahead with the multivitamins cover, like vitamin C. We're using N-acetylcysteine also quite frequently as a part of anti-inflammatory antioxidant
Oh, so
cover.
this is the NAC, isn't it? The N-acetylcysteine.
Yes.
That's the same one I've used for years for treating paracetamol overdose, I think, isn't it?
Sure.
It's the same one, yeah,
Yes.
N-acetylcysteine. So you're using that as an anti-inflammatory?
Yes, it has anti-inflammatory as well as antioxidant action also.
Uh-huh.
And it is actually one of the drugs which was used to use in interstitial fibrosis predominantly. And when we started seeing the COVID patients going into acute fibrotic phase, that is where we decided it's better to introduce this drug as a lung rehabilitation measure also.
Right. So some patients with COVID were actually getting fibrous tissue deposited in their lungs.
Yes.
And that would have longer term complications.
Yes, that was quite frequent initially when they were presenting to us, and we were quite unaware how this disease is going to progress further.
Indeed, yeah. Now, initially in India, people were using ivermectin. What's the feeling on that now?
So we have actually stopped using it now. The ivermectin, doxycycline, these are all initially being given as a sort of trial to cover the atypical infectivity, but there was no sufficient data to support it.
But when you were using ivermectin clinically, did you get the feeling it was doing some good or no good at all? What was your kind of, I'm not talking about RCT data here. What was your clinical intuition? Did you think it?
So to be honest, we were using it because at least it was not causing any harm.
Yeah, it's set safe. Yeah.
So basically that was the reason that we were going ahead with it. Whatever the benefit we can get out of the recommendation at that point of time, we were going ahead.
But your feeling is now that you're not prescribing ivermectin, so you don't think there's a benefit to it now.
The way we have experienced so far, I don't think that is really helpful.
Interesting. Thank you for that. Right. Now, what sequelae are you going to be worried about over the next few years?
So the concern is the patients who have had severe ARDS, most of the patients are going into acute fibrosis.
Oh, really? Right.
And that is why the concern is the patients who have recovered also, they keep on coming back on regular follow-ups with the fibrotic lung disease as a part of interstitial fibrosis.
Right. And you can see this interstitial fibrosis on the x-rays. This is something you can positively diagnose.
That's very common. That is very common on the CT scan also, along with the presentation of x-ray also.
Now, obviously, we've been treating the disease called idiopathic pulmonary fibrosis for years, where fibrous tissue accumulates in the lung, and that tends to get worse over time, and people eventually die of that. From your early observations so far, the fibrosis which is occurring as a sequelae of the ARDS, do you think that is that fibrosis continuing, or have they got like a certain amount of fibrosis after the infection and it's not going to get worse?
So there have been good responses of lately with the patients on antifibrotic management, and such patients, a lot of patients have shown good improvement. So to our surprise, they have actually had the reversal also of it.
Oh, excellent. Wow. So you're actually getting reversal of lung fibrosis?
Yes. So to really say whether it was actually fibrosis or it was just the early phase where it is again going back to the regular state, that is where we are right now.
Right. Because as a pulmonary physician, you wouldn't normally expect to see reversal of pulmonary fibrosis. I wouldn't have thought. Am I? Is that right?
Yes, it's against what we have always been reading about it. The way the presentation had been all throughout.
But it's in a very positive direction. So that's good.
Yes.
Yeah. Okay. And any other particular? Are you seeing any like myocarditis after infection or pericarditis after infection?
So we have been having few cases of lately of myocarditis or pericarditis, but the number is very low. Like if we look at it, it must be less than 1 in 200 or 300 patients, not even that.
And these are the patients that have come into your care that have actually been ill.
Yes.
And for that small minority of patients that got heart inflammation caused by the virus itself, Do they seem to be making a good recovery, or they've still got ongoing heart problems?
No, so most of the patients have recovered quite well who have had these complications as such.
This is actually very encouraging. So what about the long-term fatigue? Are you seeing patients with a lot of tiredness for a long period of time?
Yeah, so that is the primary complaint of such patients. So most of the patients are actually following up for 2 months to 3 months also for the heavy fatigue and severe myalgia.
Oh, so generally achy for a long period of time.
Yes.
Yeah. Now, I have heard that if we take the hospital you're working at, for example, there were 4 wards with patients. Now it's down to 1. Am I correct? Is it the number of patients is going down?
Yes. Now the number has gone down significantly, and we have actually reduced our capacity to half of what it used to be.
This is excellent.
Yes, that is very encouraging for the staff also and for us also.
Yeah, and you've had a hard time, so you'll certainly be ready for a rest. But the fact that the hospital patients are going down now presumably means the infections have been going down for a few weeks.
So that is what we hope so, and we are expecting.
Yeah. So we're optimistic that the Omicron wave in India is well on the way down now.
Yes, absolutely.
Yeah, and we're also fairly optimistic that that's going to have left a lot of herd immunity in its wake.
Yes, we are hoping that this is the beginning of end of pandemic now.
Yeah, wouldn't that be great? Yeah. My thinking is that typically, if you take coronavirus respiratory infections, the immunity is probably lasting for a year or 2.
So that is what is expected with any viral infection. The immunity is going to last 6 months to 1 year as a regular for any viral infection. And that is what we expect. Obviously, this coronavirus is going to stay with us, and it is going to become a regular endemic the way other viruses have been.
Yes. So, but because it's endemic, people will be re-exposed every 6 months or so. And every time they're re-exposed, that's going to reboost their immunity.
Yes, that is the possibility.
Yeah.
So we are hopeful that it will become a regular viral infection the way other viral infections are.
Yes.
That we don't have to treat them also.
Yeah. Are you personally worried about new variants arising, or do you think that the Omicron, especially the BA2 Omicron, is so infectious, it's going to outcompete other potential new variants?
So there is a possibility, because this virus has been mutating quite at a rapid rate, the way it has been so far. And that is what only the thing which worries me. It should not go into again the virulent phase.
But the BA2 is so transmissible. It's certainly going to become endemic. I mean, is it as transmissible as something like measles? It must be getting close to that level of infectiousness, do you think?
The way it is, it looks like that.
Yeah, quite incredible. So it's going to be with us for the foreseeable future, but in endemic form. We hope. Yeah.
Yes.
So, now, what other common medical problems are you treating regularly in India as your day-to-day work? What are the main pathologies that you treat before COVID, and you probably will be treating after COVID?
So basically here, most of the patients are coming with, like, half of the population has been exposed to quite tubercular infections in India.
TB, yeah.
That is one major infectivity which is quite highly burdened in India. Apart from that, obviously asthmatics, chronic bronchitis patients are very common. There has been a big pollution problem in India in general. So that is one challenge which we are facing of lately quite frequently.
Yeah, and we do see news reports about really bad pollution in New Delhi, for example, and it sometimes looks pretty bad. And slightly different question, but are you seeing the multiple drug-resistant tuberculosis?
So we are getting a lot of cases of multi-drug resistance over here. As in pandemic in general, people were all staying home, so they were not really exposed to sunlight. Lot of other stress factors were there where they were not treated adequately because of the COVID, they were not ready to come out to reach to the hospital to take care. So all these factors are now coming into role play, where patients are now coming up with all sorts of infections which were ignored for the past 2 years.
Yeah, so there's going to be plenty to be doing. Let's hope that COVID is no longer part of your daily workload, because there's plenty of other things that that certainly need treated everywhere, but in the Indian situation particularly. So over the next few years, we're basically hoping for the herd immunity. I think you've answered that. That's encouraging. I mean, new viruses do come all the time. There's no reason why this one should be particularly different to all the others now that the immunity is carrying on. Is India carrying on with the vaccination program? Is that still going on quite markedly in India?
So here it is on a good basis. Like, most of the people are getting vaccinated. Even the youngest of the lot, adolescents, are also started to get vaccinated now. Most of us have been given the booster doses. So precautionary doses have been taken by most of us now. Now we are waiting for the children to get vaccinated once it's available for them. And that is where we'll be feeling absolutely safe for our younger generations.
Yeah. And it's mostly the Oxford-style vaccine that's being used in India, isn't it? The adenovirus vector vaccines.
Yes. So we have Covishield and Covaxin, and only these two vaccines are being administered off lately in India.
Yeah, that's great. Doctor, thank you so much for your time. I know you've had a really busy time, and I'm now eating into your weekend. So we are very grateful for you bringing us up to speed on the situation in India. And I know very many people are very grateful for what you've done, and many people are alive because of that. So giving us time is really very kind of you. So thank you so much, and we wish you and indeed your city and whole country all the best possible outcomes for the next few months. So thank you very much.
Yeah, thank you so much. And I must say that you've been doing a tremendous job by doing these videos and regularly publishing it on net. It's been free of cost, available to everyone, and it's really knowledgeable and deeply showing the details of how things are.
Yeah, that's very kind of you to say so, but I think my job's been slightly easier than yours. But thank you. I'll certainly take that. Thank you. And God willing, we'll talk again at some point. Thank you.
Yes, definitely. It was very nice speaking to you.
Yeah, thank you.